Hello, good afternoon. My name's Hayes Gladstone of the Gladstone Clinic, and this is George, who has acne scarring. And today I'm going to inject Bellafill into some of George's acne scars. And Bellafill is an exciting new product. It has been around, but it's been changed and altered into a substance and gel that's safe for the appropriate patients. What's good about Bellafill is that it's permanent, and so you don't need to keep going back and being injected. It's good for a number of different types of patients, but in my opinion it's best for those patients who have acne scars. Acne scars have always been difficult to treat. We usually do treat with multiple types of treatments, from lasers to radiofrequency to subcision to different types of fillers to microneedling, even PRP maybe. But even with fillers, or even cutting out the acne scars, but there isn't one magic bullet. And particularly with fillers, if you inject some of these fillers, they go away within 6 months, and they're too soft and they don't distend or make the topographic part of the face smoother, and that's what we're trying to do. However, Bellafill, again, is different. It's really good for acne scars, and it'll last for about 5 years. So once it's corrected the area, it's going to stay that way, which means that it's going to be less expensive, more cost effective for the patient, and more satisfying for the patient in the long term. It can also be used in the smile lines and other parts of the face, but again, I prefer to use it with acne scar patients, again, because it's permanent. It's best for those acne scars that are rolling, or we call distensible, which you can stretch out, and then I inject them. It's not good for what we call ice pick or very deep, narrow scars. So it's really just ones that will stretch, and we call them rolling scars. It's best for that. The technique, aside from injecting into the deep dermis, is that initially I'll actually do subcision with the needle to break apart the scar, so I create a little pocket, and then I will inject in a thread-like motion, and then I will massage the area to smooth it out. You can get swelling from this. It goes away in a few days, and then kind of what you see is what you get. It'll stay that way for a long time. So again, with Bellafill, it's what we consider a permanent filler, and you have to definitely choose the appropriate patient for this filler. Okay, so George, I'm going to stretch, and I'm looking for them, and as you know, this is a 26 gauge needle, so it does sting a little bit. And I'm just priming this. There we go. So first I'm going to do a little subcision, little stick, I'm sorry. And I'm also going in, I'm in the deep dermis. I'm pulling back just to make sure that there's no blood in here, and then I'm going to inject in a threading, staying in the same depth. And I'm massaging. And it's a very firm massage because this is a permanent filler, and if you leave lumps, it will stay that way, and hyaluronidase does not work with this filler, so you want to make sure it's smooth. You can see already that there's a depression there. It's already less. Going right in here, sorry, a little stick. Doing subcision. Doing okay?
Mm-hmm.
Okay.
Absolutely.
The bevel is up. Again, I'm using a threading technique. And depending in the It's the size of the acne scar, but I'm using about 0.1 cc's per area, per little acne scar, and then again I'm massaging it firmly, molding it. So I'm molding the product. And you don't want it to be too shallow. Again, it's really the deep dermis. You don't really want to use a depot technique. Again, it's a threading technique because if you use a depot, you may get some lumpiness, which we really don't want. You can go deeper, but it won't show as much. I mean, you are safer deeper, but then you won't get as much of an effect if you're deeper than the deep dermis. Really, the deep dermis is where you're injecting with this product, with Bellafill. Sometimes I have to switch needles just because it does get dull with the subcision that we're doing, because I'm using it as an instrument, just not as for injecting the substance. And again, the benefit of this is that it lasts 5 years, which is far more than any other filler except micro droplet silicone. But it's much longer than Sculptor. I also like Sculptor a lot for volumization, but Sculptor generally is going to last about 2 years, maybe a little bit longer, depends. But again, really the philosophy for acne scarring, because there's different types of acne scarring and it's complex, is going to be different types of combinations of different types of treatments. Generally some type of resurfacing, some type of subcision, some type of filler. So I'm pulling back the plunger and then again slowly threading and making sure to stay in the same deep dermis, not too shallow. And in general, I'll do it diffusely too. I'm trying to look for distensible scars, but also diffusely it'll plump up the skin and make the topography a little bit smoother anyways, in addition to going to injecting each distensible scar. So George, you had less. I had previously done George's left side. You can take a look at that. I did that last week or 10 days ago. George had more distensible scars and more acne scarring on his left side. Certainly there's ice picks on this right side that will have to be treated and have been treated previously. But so again, I'm molding, really massaging it and making sure that there aren't any lumps. And I do encourage my patients, you can do it at home, you can help try to smooth out any lumps, that's okay. Although generally you shouldn't really, you're going to have swelling after the procedure, but there shouldn't be perceptible lumps per se, just swelling. Although you will feel this material, it's soft, but you will feel it in your skin.